I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everyone. If I can just ask everybody to just stand for one more moment. I just have a few words. You can see we have the Marine Corps League here. In the last week, unfortunately, we had the loss of Richard Caridi. He was a dear friend of mine. Me and him were close friends. It was in 2011 that I really became very good friends with Rich when we first ran for office. And he was a leader in our community, but he also taught me a lot about how to do this job, and I'm forever grateful to him for that. It was a sad day when I got that call. So everybody knows last week I was in Texas visiting my grandchildren, so I was not hiding. But I got that call down there about Rich's passing, and it was a very emotional time for me at that moment. Rich lived a great life in this community. He served well in the Marine Corps League. He served in the Marines, but he also served our community. He's on the school board in Wallenpaupack. He served as a supervisor in Blooming Grove, and he served as, I believe, 15 years here as a Pike County Commissioner. And he showed true leadership to this county every day that he came into this office. So I just want everybody to just bow their heads and remember Rich and remember his wife, Bunny, and his children. They are extremely in our hearts today and in mine, and will continue to always be in our thoughts and prayers as we move forward in our lives. Thank you. So we have the Marine Corps League here to do a little presentation in remembrance of Rich, and I'm going to hand it over to Gary. Is it?
Thank you, Matt.
Thank you.
I met Rich years ago, probably 25, 26 years ago. I knew who he was. We were at some function here in Milford, and he and Carl Wagner come walking over to me and he goes, "Where did you get that hat?" And I looked at him and smiled. And he said, "My grandchildren call me Papa. I had this hat that my daughter bought me. It's the world's greatest Papa. And he said, I got to get one." And I said, "Well, you got to go to Key West." So Carl looked at me and said, "Dad, you got to go to Keys." And I said, "Well, any excuse to go to Keys for the good." And then he saw I had a small silver EGA on my cap, Marine Corps emblem. Marine, I said, yeah, me too. So, he had introduced himself. Obviously I knew who he was. Well, we became instant friends. And before I knew I was in the detachment, and he was our chaplain at the time, and we did a fantastic job for us. Every function we had, he was involved, working our golf tournament, and I'm very proud to call him a friend. And there's no doubt in my mind that God's going to embrace him into his loving arms, and he'll have an eternal peace until he meets with his loved ones again. And for that, we'd like to honor him with a soft rendition of Caps. Right? Two. talked to Rich 2 days before his surgery. And Rich being Rich, he knew I had some serious health issues the last 2 months. He told me, I'm praying for your full recovery. Always thinking about the other guy. Thank you, man.
Yes, he was always thinking about the other guy. Anybody else, any other members have any words to say? We will all miss him. And I know we missed him in this office when he decided to retire, but that was his time. And I know that from that point on, he enjoyed his grandchildren, his family, and he traveled. So I'm glad he had that time to be able to celebrate his life with his children. So with that, thank you all. Remember Rich and remember his family. Thank you, David.
Thank you.
Thank you for your service.
You're welcome. Thank you very much.
See you, Barry. Be well.
Probably a pleasure. Thank you.
Thank you.
Okay, so we'll start the meeting, and are there any public comments or questions concerning today's agenda? Seeing none, we'll move on to the first item we have to do is amend the, this motion to recess the commissioners meeting and hold a retirement board meeting.
Motion? Second.
Motion is second, all in favor?
Aye.
Okay, call the retirement board meeting to order. And we need a motion to approve the September 20th, 2023 agenda.
Motion? Second.
All in favor?
Aye.
Motion to approve the August 16th, 2023 minutes.
Motion? Second.
Motion is second, all in favor?
Aye.
For the new business, motion to approve the refunds of contributions to employees no longer with the county, and who there are 8 people listed.
Motion? Second.
Motion is second, any questions? All in favor?
Aye.
Motion to approve the following retirements, there's 2 names listed.
Motion? Second.
Motion is second, all in favor?
Aye.
Motion to adjourn the retirement board meeting.
Motion? Second.
Motion is second, all in favor?
Aye.
Motion to reconvene. This is a motion to reconvene the commissioners meeting.
Motion? Second.
Motion is second, all in favor?
Aye.
Before we do the next one, we just have one addition on here, and that is to add to the end of the agenda, a motion to amend the agenda to include an item under new business resolution 2336, National Recovery Month, September 2023.
Motion? Second.
Motion is second, all in favor?
Aye.
Motion to approve the September 20th, 2023 agenda.
Motion? Second.
Motion is second, all in favor?
Aye.
Motion to approve the September 6th, 2023 meeting minutes.
Motion? Second.
Motion is second, all in favor?
Aye.
Motion to approve the September 13th, 2023 conference minutes.
Motion? Second.
Motion is second. Any questions? All in favor?
Aye.
Motion to approve payment from the general fund county bills in the amount of $1,225,540.04.
Motion? Second.
Motion is second. Any questions? All in favor?
Aye.
Motion to approve payment of the employee health insurance fund in the amount of $159,634.05.
Motion? Second.
Motion is second. Any questions? All in favor?
Aye.
Under personnel, motion to promote Renee Gifford to second deputy in the recorder of deeds office effective September 25th, 2023.
Motion? Second.
Motion is second. All in favor?
Aye.
Motion to recess the commissioners meeting to hold a salary board meeting.
Motion? Second.
Motion is second. All in favor?
Aye.
The salary board, motion to convene the salary board.
Motion? Second.
Motion is second. All in favor?
Aye.
Motion to approve the August 16th, 23rd, and 30th, 2023, and September 13th, 2023 salary board minutes.
Motion? Second.
Motion is second. All in favor?
Aye.
Motion to increase the annual salary of Renee Gifford to $33,750 effective September 25th, 2023 due to a promotion to the second deputy in the recorder of deeds office.
Motion? Second.
Motion is second. All in favor?
Aye.
Motion to increase the hourly rate of correctional officer Cornisha Henderson Mundy to $32.89 per hour, retroactive to September 11th, 2023, due to the terms of the collective bargaining agreement between Pike County Correctional Officers, AFSCME, AFL-CIO, District Council 87, Article 9, job classification and compensation for 4 to 8 years prior correctional experience.
Motion? Second.
Motion is second. Any questions? All in favor?
Aye.
Article 5, motion to adjourn the salary board.
Motion?
Motion is second, all in favor?
Aye.
Motion to reconvene the Commissioners meeting.
Motion. Second.
Motion is second, all in favor?
Aye.
Under old business, motion to award the bids for the rebid Bennett Avenue Building 1 interior renovation project, general contractor to Charles Green Construction in the amount of $1,068,328. No electric contract bids were received for this project.
Motion. Second.
Motion is second, any questions? All in favor?
Aye.
Motion to award bid for the Bennett Avenue Building 1 interior renovations project, mechanical contract to Myco Mechanical in the amount of $483,000.
Motion. Second.
Motion is second, all in favor?
Aye. Aye.
Motion to award the bid for the Bennett Avenue Building 1 interior renovations project plumbing contract to LH Reed and Sons in the amount of $141,584.
Motion. Second.
Motion is second, all in favor?
Aye.
Motion to re-advertise bids for the Bennett Avenue Building 1 interior renovations project electrical contract.
Motion. Second.
Motion is second, all in favor?
Aye.
Motion to open bids for the purchase of groceries and frozen foods for the period of November 1st, 2023 to February 28th, 2024 on behalf of the correctional facility.
Motion. Second.
Motion is second, all in favor?
Aye.
We have 3 bids received. The first one's from Bernard Foods, and so everyone knows the bids are going to be completely different, each and every one, because each vendor selects certain items they wish to bid on, and none of them bid on everything. Some on a few, and some on most of them. So Bernard, their total bid is $15,194.20 with a bid bond. The next one is from Magilla Foods. The villa's total bid, $223,720.69. The last bid's from Cisco. Total bid, $175,102 and looks like 89 cents. Obviously, I'd ask that the motion be made to table bids until they're reviewed by the board administrator.
Motion.
Motion until October 4th, wait, that, award them on October 4th, okay. I have a motion, and a second, all in favor?
Aye.
Carried. Okay, next item is motion to award the bid for the purchase of fortified flavored beverage bases for the period of October 1st, 2023 through September 30th, 2024 on behalf of the correctional facility, the Bernard Food Industries, for a total bid amount of $9,377.28.
Motion. Second.
Motion is second, all in favor?
Aye.
Number 7, motion to open bids for the 2023-24 winter maintenance of county roads.
Motion. Second.
Motion is second, all in favor?
Aye.
One bid, as always, each and every year from Lattimore Construction. No one else ever bids on this project. It's no problem.
And we'll let we get one, otherwise we'd be up there shoveling it.
Yeah. That's what they're willing to do.
Yeah.
I think it would be a job for a retiring commissioner from another town.
And the bid is $577.50 per application for plowing, $183.75 for sanding only, $288.75 for salting. I don't know if you want to.
Well, I think what we should do is let's just, I know it's only the one bid, but we should just table it, review it from last year's bid and see where it falls. And make sure that
Just so you know, there's 2 of them, I apologize. One's for Bennett Avenue, the other one's for 2 more, Brookstone, Stone Quarry Road, and that's $1,023.75 per application, plowing and sanding. $433.65 for sanding only. And then Old Owego, which is the one that's also they do, would be $531.30 per application for plowing and sanding, and $295.68 per application for sanding. So you may just want to double check.
Yeah, we just want to look it over and make sure. I'm sure he's bid on it for the last 12 years. I'm sure it's the same.
Since I've been solicitor.
Yeah, so I need a motion to just table it for the October 4th meeting.
Second.
I have a motion and a second. All in favor?
Aye.
So done. Motion to authorize the chairman to execute the federal financial report for the Kings Creek Dam project.
Motion. Second.
Motion and a second. All in favor?
Aye.
Under new business, motion to adopt resolution number 2335, a resolution of the Pike County Commissioners delegating authority for the Executive Director of Human Services to sign the agreement for residential housing inspection services for the whole home repair program and other related housing rehabilitation programs.
Motion. Second.
Motion and second. All in favor?
Aye.
Okay, number 2, motion to approve the following human service payment vouchers on behalf of the Office of Human Services Development Fund in the amount of $19,857.06, Whole Home Repair in the amount of $2,437.50, and State Food Purchase Program in the amount of $824.04.
Motion. Second.
Motion is second. Any questions? All in favor?
Aye.
Motion to approve the affordable housing payment voucher in the amount of $1,243.75 payable to the Hailstone Economic on behalf of the Office of Human Services.
Motion. Second.
Motion is second. All in favor?
Aye.
Motion to approve the 2021 CDBG program payment voucher in the amount of $11,031.25 payable to Hailstone Economics on behalf of the Office of Human Services.
Motion. Second.
Motion is second. All in favor?
Aye.
Motion to execute the contract with professional services between Forensic Counseling Associates, LLC, and the County of Pike on behalf of the Children and Youth Services.
Motion. Second.
Motion is second. All in favor?
Aye.
Motion to authorize the chairman to execute the 2023-24 transportation plan between Delaware Valley School District and Pike County Children and Youth Agency.
Motion. Second.
Motion is second. All in favor?
Aye.
Motion to execute the purchase of service agreement between the County of Chester and the County of Pike on behalf of Children and Youth Services.
Motion. Second.
Motion is second. All in favor?
Aye.
Motion to authorize the chairman to execute the redevelopment assistance capital program RCAP extension request letter for funding of the Forest Hall Event Center Improvement Project.
Motion. Second.
Motion is second. All in favor?
Aye.
Motion to authorize the chairman to execute the Pike County Fentanyl Awareness Campaign Agreement.
Motion. Second.
Motion is second. All in favor? Aye. I'll just touch on that. That agreement is coming out of and being paid for with the funds that were allocated to the county through the lawsuits against the opioid manufacturers. The county was one of the first counties to file lawsuits against them, and then we were combined into some larger lawsuits, first with the state and then I believe nationally. But this is the funding where that's coming from. We're beginning to spend those dollars with different programs, and we're going to, in a few minutes, we're going to have the resolution about Awareness Month, and we have Shannon here to speak to it, and we'll talk a little bit more about there. So the next item I have on here is a resolution to approve resolution number 2336, National Recovery Month, September 2023.
Motion. Second.
Motion is second. All in favor?
Aye.
Ron, can you read that?
Or would you like to?
Okay, good. Yep, okay.
Resolution number 23-36, National Recovery Month, September 2023. Whereas mental health and/or substance use disorders affect all communities nationwide, but with commitment and support, people with these disorders can achieve healthy lifestyles and lead rewarding lives in recovery. By seeking help, people who experience mental and/or substance use disorders can embark on a new path toward improved health and overall wellness. The focus of National Recovery Month this September is to celebrate their journey with the theme, Recovery is for everyone, every person, every family, every community. Recovery Month spreads the message that behavioral health is essential to one's overall health and wellness, and that prevention works, treatment is effective, and people recover. And whereas the impact of mental and/or substance use disorders is impairment in our communities. Through Recovery Month, people become more aware and able to recognize the signs of mental health and/or substance use disorders, which can lead more people into needed treatment. Managing the effects of these conditions can help people achieve healthy lifestyles both physically and emotionally. And whereas the Recovery Month observance continues to work to improve the lives of those affected by mental and/or substance use disorders by raising awareness of these diseases and educating communities about the prevention, treatment, and recovery resources that are available. For the above reasons, we are asking the citizens of Pike County to join us in celebrating this September as National Recovery Month. Now therefore, we, the Commissioners of Pike County, do hereby proclaim this month of September 2023 as National Recovery Month in Pike County, Pennsylvania, and call upon our community to observe this month with compelling programs and events that support this year's observance. And I'd just like to add that 43 years ago, some people in my community, including my family, convinced me that I needed to get treatment because I was an alcoholic and a drug addict. And fortunately, I was able to lead a healthy lifestyle, and it was the best thing that ever happened to me in my whole life, that's for sure. Not only because I was able to have a meaningful life, and fortunately I was lucky I had not gotten married, I hadn't put my problems on anybody other than my parents and my brothers and sisters. My brother was a doctor, he was the one that convinced me. And with the help of some attorneys in our community who had resources to make sure you got in a treatment place whether you have money or not, I was able to get the help I needed and recover. And I've since then been helping other people. I've been on the Lawyers Concern for Lawyers Board for 28 years now, and I just stepped down as their secretary. But I'm also, as you can tell, fine with sharing that because it is a meaningful thing in my life. And it is important, and Shannon can speak to it more because she's the professional, but it's important that people understand that it's okay. Like, I'll never forget, I got sober slightly after Betty Ford went into rehab, and of course they ended up naming the rehab after her. And that one instance where the public realized that someone like her had a problem and could deal with it really helped with the idea of getting people help. It's true, right? Not about me, but I do appreciate that I was able to share that resolution and celebrate it. Thank you.
Absolutely. So, I mean,
This is Shannon Wisniewski. She is the...
I'm the supervisor for Carbon Monroe Pike Drug and Alcohol's Pike Outpatient Office. So we service all 3 counties for folks that either don't have insurance or are underinsured, with making sure everybody has access to getting treatment in all levels of care, regardless if they need detox, rehab, or outpatient services. We also do case management services in all 3 counties to make sure that we're addressing those non-treatment needs. So we know that folks that are addressing these issues, that are living with these issues every day, are going to have multiple issues throughout their lives, whether it's with housing or employment, so we help with those services as well. Part of the awareness campaigns that we're looking at, part of our outreach services that we do is no door is the wrong door, right? People deal with substance use issues, they're dealing with mental health issues, they're dealing with suicide crisis issues. Any door you walk into in Pike County, you should be able to access whatever services you're going to need. So you'll see sitting on like a number of different committees. I sit on our Northeast Suicide Prevention Initiative. We sit with our mental health. We address, the children and youth issues as well as our legal issues, because our folks are coming into contact in a number of different ways in our county. So we want to make sure that folks have access to services, that they're able to look at what services they need and not be worried about, I don't want to say this part of it because I'm afraid of the stigma that comes with that. A lot of the outreach we've done throughout the community in the last year has been to community events. This past weekend, we had our suicide prevention walk, which we did at Paul Pack High School. And then I was down at Harvest Fest down in Digman, Delaware Township, to make sure we were reaching out to the community there with suicide prevention materials as well as substance use and mental health materials. The awareness campaign that the commissioners are sending into is out of those opiate use disorder dollars that were part of the lawsuit. We've been here as Carbon Monroe Pike Drug and Alcohol with our outpatient for 3.5 years, and people still turn around and go, I don't know where to get services, I don't know who to reach out to for help. And the awareness piece with the fentanyl specifically is folks in our community, and a lot of what we're focusing on here at Pike and what we've been able to do is reach out to our elder populations, because people without insurance, things like that, that may be purchasing prescriptions off the street, aren't buying what they think they're buying. A lot of the times we are seeing those pressed fentanyls and things like that that are not the prescription pills they think they are. So we want to make sure that we're doing that outreach there, as well as with the other 2 counties, Monroe and Carbon, are really looking at our adolescent populations, our school populations, and being able to tell kids what the issues are and what they're afraid is going to be in the substances. It's not the same substances that we dealt with 20 years ago. A lot of the things we're seeing are laced with other things, laced with fentanyl, and of course that's leading to more suicide risk, more of our emergency responders calling out for 911 calls, and obviously our access to Narcan through our office as well.
Yeah, it's important that we share all this information with the community. I'm sure everybody's aware of the news just a few days ago in New York City with the daycare. What were they doing in there? They were pressing fentanyl into pills, and they ended up having a young 1-year-old pass away from this. This is the tragic stories that are going on in our community, and that's why we are focused on putting together awareness programs and making sure that people understand that if they're suffering from some addiction, they're suffering from mental health. You know, being at the suicide prevention walk the other day, that's a very sombering moment to be there with family and members who have suffered through this. And I'm sure everybody in this room can relate to someone in their life or friends or family that have suffered through those type of horrors in their life. We need to make sure that people know that the services are out there. We've got to make sure that the stigma is not there, that if they need help, they need to reach out. I put a number of handouts here, you know, whether it's for veterans or whoever it's for, and the veterans population is extremely affected in this community by suicide. In fact, I believe that Pike County and Monroe and this area have some of the highest suicide rates among veterans. We need to figure out why that's occurring, and whatever we need to do in this office and through Carver Monroe Pike and MHDS out of Stroudsburg, our joint board, we need to do all we can. These are statistics that we should not be allowing. As they said at the walk, suicide is preventable. And we as a community need to work towards how we can help that happen, how we can make it preventable, how we can reach out to those families that feel like there's just total despair in their lives, that we are here to help them. So I know Shannon's office works diligently at the opioid side of this. There is just some scary times out there with these fake pills. That program that she speaks about that we just signed that contract, that's an educational component. That's going to be billboards, that's going to be work in the schools, identifying this whole thing with the fentanyl issue that's going on with fake pills. Back to that story in New York, right? That's what they were doing. They were pressing pills and pushing them off as maybe some other type of prescription. You know, we think that this is an effect that can only affect people that are addicted to these products. But, you know, think about the cost of prescription drugs out there. And if somebody is out on the street trying to sell things that they're saying are oxycodone or whatever for medicinal use, because some people do need those prescriptions, and they're buying them for $10 as opposed to the pharmacy where maybe they're $20. The next thing you know, we have senior citizens dying from fentanyl overdoses. This is just going on throughout our country, and it's not, Pike County is not immune from this, nor is the northeast of Pennsylvania. It is here, and all you have to do is speak to the district attorney and hear his stories about what's going on in all of our communities around here. So I know, are the pinwheels still on the?
No, the pinwheels came down last week. So August 31st, 122.
Yeah,
So
so 122 overdoses.
Yep,
in Pike County.
Since 2014.
And we know, we can touch on, we know that there's more. Just that some of them are not reported in Pike County, and this has to do with the fact that we don't have a medical provider in our county. So if somebody is transported from Pike County because of an overdose and they pass away in some other jurisdiction, whether that's Monroe, Carbon, or Monroe, or Wayne, or Sussex County, New York, New Jersey, or Orange County, they are not reported to us. And I'm not saying that we want to know these numbers, but don't think that 122 is just the number. The number is higher.
Those are fatal overdoses?
Those are fatal
These are
overdoses.
fatal overdoses, yes.
Yeah.
And,
Well, and part of that number is, we know that, you know, our ambulance responders and things like that, if they're responding to an overdose, and we get those numbers from the 911 center too, but when we're looking at those fatalities, it's people that have actually died in the county. If they're transported to a hospital in another county, those numbers are counted in those counties and not here. Part of why those numbers matter and part of why we're collecting that data is because things like the opiate use disorder dollars and those lawsuit dollars look at the county and go, okay, well, our overdose trend is still higher than the state average, but it's not Philly. It's not, you know, some of those other counties where the money, you know, were obviously much higher, you know, and obviously we'll continue to advocate and fight for what the substance abuse issues look like in Pike County. But those pressed pills, they look exactly like what you would buy at the pharmacy. really it's very, very hard to tell what is a real pill versus a pressed pill unless you're, looking at under a microscope and have been trained in pharmaceutical practices. So, we continue to outreach and, make sure the kids are aware, and we'll be at Warrior Fest on the 30th. We'll be at VIP's event on the 30th. They have their glow run. But being able to kind of reach out to folks in some non-traditional ways seems to have worked best in Pike County because, folks aren't aware of where to receive services, aren't aware of the dangers. Unfortunately, we've seen, fentanyl in marijuana in Pike County. We've seen, people that are buying Adderall off of the street that end up looking like methamphetamine. So we have to really make sure that everyone is aware of what the stigma looks like, what the dangers are, and how to get those services. So you guys put up different things with regards to like the crisis intervention services. Like I said, the new suicide prevention number is the 988 number. So we brought additional magnets and stuff for that. Even our outreach with like fetal alcohol month and things like that, making sure that people are aware of the dangers of what you're putting in your body and the effects it can have on your health and your lifestyle.
So I just want to say one thing, I just want to commend Tony for doing that, because, having somebody stand up here, and this really is us celebrating his sobriety and his found out of addiction, because that sends a signal to people in this community that you can find sobriety and you can be successful, because these are the things that people are fearful of coming out, because I'm sure you felt stigmatized too at that time of admitting this, and that's what we're here to do. We need to make sure that everybody knows that we cannot hold judgment. There should be a judgment-free zone, no judging, and everybody, and words matter. When people are out there making certain comments about why we shouldn't be using Narcan, why we shouldn't be doing this, that just adds to the stigma of this. And we need to make sure that words do matter of what we say, because these individuals are in a crisis mode. So I just wanted to.
And we continue to do the Narcan distributions. We continue to work as the CCE to make sure that our first responders, our schools, our other healthcare providers, our probation department, children and youth, are folks that are from the county that are out in the community have access to Narcan, have access to the drug disposal that we pass out, because I hope to God you never need it. But if you're in the position where you need it, I'd rather you have it and then call 911 and make sure that we're getting somebody that immediate response, because the dangers with fentanyl are there. The quicker we're able to administer the Narcan, the quicker we're able to call 911, the better off this person is going to be.
Yeah, thank you.
And thank you guys for your
quick question.
Go ahead.
One of the things that's going on up in Wayne County, as I'm sure you're familiar with, is they're looking to build a facility for recovery, multi-pronged recovery.
The crisis intervention.
Exactly. They've run up against several brick walls, so to speak, funding-wise. They were expecting to spend something like $8 million, and the bid came in for $17 million just for the first phase of this thing. So, one of the issues it seems that's going on around here, and I've seen this personally, is that parents don't know how to get their kids into some type of a recovery program in this area. I mean, they're being shipped off to places like Pittsburgh or perhaps even out of state. What's going on here at the grassroots level? Where does a parent need to go first? And then how do they, avoid having their kids shipped off to, 6 hours away or something like that? What's going on here in Pike and Wayne?
Absolutely. So in Pike and Wayne County, as well as in Monroe and Carbon, we see each of our schools participates in a prevention program within the schools. So we have prevention specialists that go into each of the schools, starting from elementary through high school, that go out, speak to the kids. They're identified as high risk through the SAP programs, through their guidance counselors. The parents can reach out to the school. We've seen this continued increase in adolescents with additional mental health issues, additional addiction issues, where we're actually identifying kids as young as 14 that need drug and alcohol treatment services. So the earlier we can get them into treatment, the less likely we are to have to send them out to rehabs and detoxes and things like that. We do have a number of adolescents that are in our outpatient programs here in the county. So they come to our office, we assess them, and then we'll work with the parents as well as the adolescent or teen to be able to get them the treatment services they need. So we offer that right here in the county. Wayne County is the same way. The Wayne County Drug and Alcohol Office does the prevention for Wall and Fallback schools, and then they also refer out to the outpatient program. So The other options we have is we contract with PATH, which has a day treatment program, so the kids can go there during the day, get treatment, and then come back to their home lives. In the evenings, there's bus transportation for that. The schools participate in that. They make sure the kids continue to get their education while they're there. So very rarely do we see this kind of dynamic where we're sending adolescents out, further out, just specifically for addiction issues. Sometimes when it's coupled with those additional mental health issues, though, is where we're seeing the longer wait times and being able to access services and where they're being sent further out from the county.
So what should a parent do first if they know their kid has a problem? The very first thing they should do, who should they pick up the phone and call?
So they can reach out to the schools as well as their guidance counselors, or they can contact our office directly. The hotline is 24/7, so even if it's late at night, they're sitting there with their teen and this is what's coming up when they come home from school, they can still access the hotline numbers and things there to be able to get in touch with one of us. And like I said, no door is the wrong door. So if they call us and it's primary mental health, we'll make sure that we're doing that warm handoff to mental health services. So even if it's, hey, I know this person, let me call there, that's fine. Whatever door they need to access, we'll make sure they get to the right places.
Thank you.
I have a question, please. Is this for young adults, can they go the same route? Because a lot of them are dropouts. I'm dealing with this with a relative in New York. It's horrible.
Absolutely.
All right, so it could be for anybody, this hotline number?
Yep, and we'll connect them. Like if it's not our county and not our state, if they reach out to the hotline number, we'll pull up and find out where exactly they need to go in the county and state they live in.
That's good, thank you.
Yep, we're able to use Atlas, which is a search service that we contract with as well, and that we've been able to make sure that we're able to look in different states. If they participate in Atlas, we look that way, or we'll use the SAMHSA website to be able to identify which county and state they're in and where their services are.
Okay, thank you.
Linda, can you identify yourself for the record?
Oh, sure. My name is Linda Toussaint, and is that what you want?
That's all. Thank you, Linda.
I'll leave it at that.
But yeah, like I said, I mean, thank you. They know our continued support. And like I said, if there's anything anybody needs, please reach out to us.
On this topic, the Mental Illness Awareness Campaign, you're getting federal funds.
Well, this is no lawsuit funds. This was the opioid, you've seen this across the nation.
So-
So we were awarded, funds from that.
How much?
Well, over the course of 17 years right now, this is the initial block of money that will be spread out. Right now, we've gotten $250,000. We will get another $143,000, I think, coming into this month, and then it'll be spread out over the next 17 years. That's the first tranche of money. The next amount of money will be coming from, and again, this is in the national news, the Walmarts, the CVS's, the Rite Aids, all of the pharmacies that were also named in this lawsuit, and they're going to be paying up. So this is where that funding is coming. We have other programs that we're putting together. This is the first, because what the requirements on this is we need to show or spend most of the money within 18 months. Which, we have to be careful that we don't just, because they put that kind of time crunch on it, that we don't just waste it. We want to make sure that we're effective with the money. So this is the first campaign that we're doing. We have meetings once a month with the district attorney, with Carmen Monroe Pike Drug and Alcohol, the Sheriff's Department, on what the other programs we can do in the county to identify people with addictions and also offer treatment. We have a medical assistance treatment program in the correctional facility that can be funded out of this, so that we can make sure that people get the needed services they need in there.
So how much are you spending on this?
This is $50,000.
$50,000.
This was a $50,000 contract, and now we're going to work with the schools and everybody on what that contract will look like. Like I said earlier, it will be some billboards, it'll be educational material, and we're going to work through that with this company who has already contracted with Monroe County and Carbon County, and I believe Northampton.
Is that company name on here? I don't think it is.
It's called Kudo.
Kudo? Like kudos?
Like kudos. KUDO. Yeah.
They're from down in the Lehigh Valley area. KUDU.
And Matt, do you ever foresee some type of recovery facility here in Pike County being built, like they're trying to build in Wayne County?
Well, we could. We have. Good. I'll let you answer,
Yes.
because she's closer to this than we are.
So part of that facility is including Pike. So part of those resources that were awarded were with Monroe, Pike, and Wayne counties to be able to access those services. So when they're looking at that crisis intervention kind of ER style piece that they're trying to create there, which is going to be a walk-in crisis center, is part of MHDS's effort to make sure there's more access within all three of the counties.
We do have a treatment facility right now, and
The drug and alcohol treatment facility, yes, there's a rehab, a detox, and then the outpatient facility there.
Where's that?
Malibu.
Malibu is,
Malibu, and
yeah,
there's
foster
another-
wellness.
there's a detox opened up where?
The Malibu is technically in Westfall Township, but it's right on the border of Milford Township and Westfall Township. If you go all the way up Route 7 to the, or 7th Street to the end, then they recently opened a detox in Dignam Township.
Okay, forgive me if I'm wrong, but it doesn't, from what I understand, Malibu doesn't take insurance, and it's not, they
They
do.
do,
Okay, because
they
I.
do, and they're also contracted with us for folks.
Yeah, they're
Yeah,
contracted.
so somebody, I really want to be clear on this. So somebody who's a Pike County resident who has an issue can go to Malibu and what happens?
So they would contact us, or they can contact their admissions piece first, and then we would determine whether or not they need that level of care. And then we would make the referrals appropriate and make sure to set up a bed date.
Who pays?
So if they don't have insurance and they're a Pike County resident and they meet the income qualifications, then we do. That's part of the single county authority funding.
Okay, thanks.
And you are correct, when they initially opened,
Right.
they were not.
I was gonna say.
This is a process, like everything else that goes on. They needed to get licensed in the state, they need to get certified, and now they are. So they're actively, they have, unfortunately, having too many.
Yeah, they're actually kind of full. But they've only been open for about 4 years.
Yeah.
And it was a slower transition there because of COVID and also that complicated it.
And then the next closest rehab that we access as well is right off of 209, right over the Pike County border into Monroe. It's technically Stroudsburg, but it's Marshall's Creek. So it's right there off of 209 is a pyramid facility as well. So there are some that are within an hour of the county. They just, CCBH, which is our state insurance program, actually just contracted with another provider out in Garbondale. So, I mean, within an hour and a half, we have a number of different rehabs we can access.
Anyone else? Okay, thank you, Shannon.
Right, thank you.
Shannon, very much. Next item we have is the Penn State Extension calendar of events, which we put on every month as a meeting. And then we have with us Rachel Moyer. As you can see, we have all these AEDs. I'll let Rachel speak to this, but this is something we had to make sure that we renewed some of them in our county facilities. But now we will be sure that we have one in every single building that the county owns.
This is so exciting to be here because the times I've been here before, it was always a process and building awareness. But the fact that Pike County has really stepped up to the plate and has used a lot of resources to get you more AEDs. Yesterday, I actually met with the governor because we're doing a bill that's only taken 23 years since the loss of my son in school. He's playing basketball and he's 15 years old, and he thought he was the coolest thing since sliced bread since he was only in the 10th grade. And on his way up to, it was, even though it's Monroe County, East Stroudsburg North, and he was playing for Notre Dame in East Stroudsburg. They came up here and it was when the school was brand new and there were not any identifications on the building. And I think about this when I go everywhere. When 911 was called, it took them 42 minutes to get there because there was no AED, automated external defibrillator, in the school to help him. And he was a healthy kid, had no signs, no symptoms, no fainting or being uncomfortable. And we were very excited and we saw him play the first half and thought he did really well. And when he walked off the court, probably 2 minutes later, one of the kids came out and said, "Mr. and Mrs. Moyer, Greg needs you." And I thought, oh, you put somebody in a locker and they couldn't open the locker now, that kid's on the other side of the locker, or you put him into the garbage can. These things that he has done in the past. So, but when I walked in that room, I saw my 15-year-old on the ground. And I was a teacher. I drove through here for 15 years and taught in Port Jervis from Shawnee on Delaware. And there's my son. I grabbed his head and I said, "Greg, you're not breathing. Why aren't you breathing?" And he opened his eyes for a split second and that was it. But I did not know how to do CPR. And there was a doctor and 3 nurses there in the year 2000. No one wanted to touch anybody because they were afraid they were going to get sued. Looking back, we've come such a long way. And you know, everywhere I go, I always say, the first thing I say, where are your AEDs? So coming in the back door, I just could go by it and I love the label, the signage. You shouldn't have to spend 10 minutes looking for an AED. It should be on the maps for the buildings, in the schools. Don't ever go to an event. And yesterday, I'm going to give you this. This had to do with the bill yesterday, but it has to do with all of your friends, your neighbors, your community. If you don't have an AED in your community, you should get one. And I'm just going to chant it. You didn't have to on to it. So, getting AEDs, they're not that expensive. The hardest ones that I face, other than the commissioners, are the school boards. And they'll say, oh, they're too expensive. I said, take out your phone. How much does your phone cost? What do you pay a month? And so my husband has words for me that I don't stop at anything. And poor Krista has been dealing with me for years and years. And Krista wanted these AEDs, and there was 265,000 on back order. And I kept on calling every single day. And I think I whined a lot, and that's how we got them now, because I'm still having people call, but I just wanted to make sure that you got them up. And we were able to save you enough money that you got additional AEDs. We're not into this to make any money. We're in this to make sure AEDs are all publicly located. When I get on a plane, too, I'll say to the attendant, where's your AED? And 99 times out of 100, I'll get, why, you think you're gonna need one? And I go, no, but if you do, I know how to use it. I mean, but it's just like, really and truly, and they're always at the back of the plane, and I think that's another goal I'm doing. It's saying, put them in the middle of the plane so you don't have to take too long. Every minute a person is down, 1%, 10% less of a chance of saving them. So even when somebody is down, call for help, get somebody that will start CPR. And hope that they use it till the AED comes. The American Heart Association says there's about 10% of the people that are saved with CPR alone. Now think about that. We have 90% of the people that need an AED to revive them. And it just, you have a widescreen TV, you have a nice vehicle you drive. Think about that and say, okay, well, I don't need this special stereo system. I can buy an AED and always have it in my vehicle. They don't like below 32 degrees or above 105. So we're pretty good here. You know, well, sometimes our winters can be cold, but it's just your support over these years that have made me so grateful. And my husband, who's a county commissioner in Monroe County, he said, make sure you tell the commissioners I help put these together. So these, you know, like, that took him, well, it takes a long time. But these AEDs, I'm gonna just grab this one. Every one of them is so easy to use, all right? You have to have about a 4th grade education. And the important thing is you do dial 911 and you put on a speakerphone and you start CPR. You identify the issue. You make sure that the person calls 911 and then you go to work. You can't do more damage than dead. And person who collapses in sudden cardiac arrest, which is 365,000 people a year, and 23,000 of them are below the age of 18. So when people say, they're still saying to the doctor, it's rare. No, it's not rare, especially when it happens in your life. We made a commitment the night that Greg died, when the nurses told us, neither one of us knew what an AED was in 2000, and they said there should have been an AED. And we're looking at them and saying, you know, what is that? But when they explained, we made a vow that we were not going to put a headstone on my son's grave until we had an AED in each school in this country. Now, Monroe, Pike County, you know, here that I can get to these guys in a half an hour, you know, but we've been really successful. But there's other parts of the states and countries. We've given away or been involved in getting lower prices for about 19,000 AEDs throughout the country. We've donated one at least to every state, and we've also trained about 30,000 people in CPR and AED. And Lorraine was just telling me about the class that she had. If this is going to be here, I want to know how to use it. So in the AED, so people aren't afraid of it. It's not going to shock you, okay? It's not going to shock somebody that doesn't need a shock. That's the power, and then how smart they are. So I'm going to tell this to Krista, because I know, no offense to you guys, but I'm going to tell her that when these go out, if they would put the date that they went to wherever this is going to be distributed. This is a battery. It's good for 4 years. And you put it in the back. Okay, it's a red light, and it's going to be green. Tell me when it's green. It's going to be green. Come on. Oh, there it is. There it is. Okay. I have hearing aids in. I am really about 70% deaf. And I can't hear with beings in crowded situations. But when I open this up, not only will it talk to me.
Stay calm. Follow these instructions. Make sure 911 is called now. Begin by exposing patient's bare chest. Remove or cut clothing if needed.
And there's a ready kit with them. I'm not going to go through the whole thing, but if you want to know, I'm sure you can get in touch with your county commissioners and they'll tell you when there will be a class. But it's really good to know what to do so you're not afraid of this machine. And I trained my 5th and 6th graders up in Port Jervis how to use it. And, make sure the scene is safe. There's not a Doberman that somebody has and, that you're not going to, it's not electric wires or something like that falling down from a tree. But this, I never go anywhere without this in my car. I never want to be in a situation where, okay, the cost of them in 2001, a bill was passed in Pennsylvania that let really the country, because it brought the cost of $3,400 down to about $1,776, and I only say that because of Philadelphia, but I think it was $1,776. So since then, they've gone up, they've gone down, they've made cheaper models. I think this is the best because it checks itself every day, and you're not going to pick this up and all of a sudden realize when you open it, oh, the battery is dead. This beeps, drives you nuts. If I want to really annoy my husband, I will take out the electrodes or I'll take out the battery and have it in the back of his car, truck. And he says, who did that? So, but the idea is this is our life. And it's so great when I get to opportunities to say, you guys did it again. I am so proud of you and I'm so grateful because it lets the beat go on. And the biggest fear that I think I have is that Gregory will be forgotten. And when it happens like this and they're going to go all to the other places in Pike County, I know the number 23 is going to be remembered. And hopefully you'll save more lives in this county. So thank you all. I love you guys. And I can't wait to go home to my husband and say, they wear ties up here. My husband owns a tie, but this is great, and I can't thank you enough, and Krista, I know it's going to all be on you, so thank you.
Thank you.
Thank you.
Thank you. But here's the check for them. We appreciate everything you're doing with us. We really do. Yeah.
Thank you so much.
Thank you.
By John not wearing a tie is like our role model, but you can see we don't follow through.
Where are they going to go? Where are these ones going?
Well, I think Krista has a list of all the offices that we identified.
They're going in every county facility and in some departments specifically, but I believe there are 18 of them and some replacement parts, but there'll be multiple ones in every county facility. And it is funded by a grant from the County Commissioners Association of Pennsylvania.
Yeah.
Is funding the project.